be your nurse today. Can you tell me your name and date of birth?
Krista Fulkerson, 7/11/96.
Do you have any allergies?
No.
All right. We're going to be doing your physical assessment today. Have you ever had one of those?
Yes.
So you know that have you sitting, standing, lying, different positions. It shouldn't hurt or anything like that. If you have any questions, feel free to stop me. Do you know what year it is?
2019.
Do you know where you're at?
Madisonville Community College.
And do you know who our president is?
Trump.
Patient is alert and oriented ×4. I'm going to start with your vitals. I'm going to assess your brachial pulse. And that's a 2+. It was 124/72, which is good. Gonna assess your radial pulse. Your radial pulse was 68 and a 2+, and your respirations were 18, so all of that is normal. I'm going to move on to your skin. Have you noticed any bumps, lesions, anything like that?
Mm-hmm.
The color is appropriate for ethnicity. There's no bumps, lesions, bruises, anything like that. The color is warm and dry and intact. It has good elasticity. The cap refill is less than 3. The hair is distributed evenly on the arms. I'm going to just palpate your scalp, and if you have any tenderness, you just let me know. The hair is brown and medium length. It's distributed evenly. There's no bumps, lesions, nits, parasites, anything noted. Do you feel any pain or anything?
No.
The head is normocephalic. It is symmetrical and proportional. It's a good shape for the body. Can you look up, down, and side to side? Patient has good control and active range of motion. Can you go towards? All right. And muscle strength of 5 in the neck. Can you open your jaw, close your jaw? Cranial nerve number 5 is intact. Gonna assess your temporal arteries. Gonna do this bilaterally. And they're strong 2+. I'm gonna palpate your sinuses. You just let me know if you feel any pain.
Nope.
Okay. Now can you raise your eyebrows? Puff out your cheeks? Any problems with that?
Mm-hmm.
Cranial nerve number 7 is intact. And now can you open your jaw? Any popping, pain, or anything? The temporomandibular joint is intact, no pain there. So now we're going to move on to your ears. They're symmetrical. no lesions or anything noted on the external ear. Have you had any drainage?
No.
Okay. Gonna pull up and back. There's no drainage, redness, lesions in the canal. The tympanic membrane is pearly gray, translucent, and shiny. No lesions or anything noted there. I'm gonna come behind you and I'm gonna whisper a word to you, and I'm just gonna have you repeat that back to check cranial nerve number 8.
Football.
And cranial nerve number 8 is intact. Now I'm gonna move on to your eyes. The pupils are a size 3 millimeter. They're round and they're symmetrical. If you could just look past my shoulder. Now follow my pen light. Cranial nerves number 3, 4, 6 are intact. Pupils are equal, round, reactive to light, and accommodate. The external structures look good. The hair, the eyebrows, and the eyelashes are evenly distributed. There's no bumps, lesions, or anything noted. The sclera is white. Can you pull down your eyelid? The conjunctiva is pink and moist. Any problems with your eyes or anything like that? All right, so now we're going to move on to your nose. The nose is symmetrical to the face. It's a good, appropriate size. You can just look up. The nasal mucosa is pink and moist. The septum is midline, no deviations, no redness, draining, polyps, anything noted like that. Can you hold one side, take a deep breath in, say the nostrils are Peyton. Now I'm going to have you close your eyes. And I'm going to wave a familiar scent in front of your face to test cranial nerve number 1. I'm just going to have you tell me what it is.
Alcohol.
Cranial nerve number 1 is intact. Now we're going to move on to your mouth. Have you had any lesions or anything, any teeth or anything bothering you?
Mm-mm.
Okay. Do you have your tonsils?
Yes.
Can you open up and say ah? The buccal is pink and moist, no lesions noted. Can you bring your lip down so I can check your gums? Any bleeding or anything when you brush? No lesions or anything noted on the gum. There are 32 teeth. They are clean and intact. No caries noted. Can you stick the tongue out and move it side to side? Cranial nerve number 12 is intact. Can you lift the tongue up? The floor of the mouth is pink and moist, no lesions noted there. All right. The palate is appropriate color, no lesions noted there. It goes from the hard to the soft palate appropriately. Can you open up and say ah? The uvula is midline and it moves on vocalization. The tonsils are a grade 1. All right, your trachea is midline. Can you turn your neck? There's no JVD or pulsations noted in the neck. I'm going to assess your carotid. And that's a good strong 2+, and I'm going to do this bilaterally. And can you swallow for me? Any trouble doing that? That's cranial nerve number 9 and 10, and those are intact. I'm going to assess your lymph nodes. This is your preauricular, your postauricular, your occipital, your submental, your submandibular, your tonsillar, your superficial cervical, your deep cervical, your posterior cervical chain, and your supraclavicular. Have you had any trouble breathing?
No.
Can you take a deep breath for me? Any Pain or tenderness, no pain or tenderness noted. No use of accessory muscles are noted. No bumps, lesions, bruises, or anything noted on the chest. I'm going to listen to you anteriorly and posteriorly. There's 5 spots on the front and 9 spots on the back that I'm going to assess. No adventitious sounds noted anteriorly. No adventitious sounds noted posteriorly. The breathing is non-labored and everything sounds good. Gonna check your expansion if you could take a deep breath. It is equal. The configuration is 2-to-1, which is equal. No pain or tenderness on any of that. All right. Now I'm gonna listen to your word sounds. Right second intercostal space is going to be the apical, or the aortic. The second intercostal space on the left sternal border is going to be your pulmonic. The third intercostal space on the left sternal border is going to be your Erb's point. The fourth intercostal space on the left sternal border is going to be your tricuspid. And then the fifth midclavicular intercostal space on the left sternal border is going to be your apical pulse, and I'm going to listen to this for a full minute. The rate and rhythm of your apical is normal, and it was 72. S1 and S2 are noted, no murmurs or anything, so that's great. Now we're going to move on to your upper extremities. Do you have any problems with range of motion? Okay, if you could just follow me. You're going to stick your arms out. They're symmetrical. Now can you rotate your wrist, bend your arms, shrug your shoulders again. Cranial nerve number 11 is intact, and the patient has active range of motion in the wrist, elbows, and shoulders. I'm going to assess your epitrochlear nodes, and those are not palpable, which is fine. Have you had any problems with your joints? No popping, clicking? Okay. No lesions, deformities noted. The joints look nice and good. No problems noted there. I would assess this bilaterally. Now I'm going to move on to your abdomen. If you could lay down for me. Do you know the date of your last bowel movement?
Yesterday.
Okay, and have you any changes in bowel movement or urination? The Umbilicus is midline and inverted, no pulsations noted. It's soft, flat, non-distended, and I'm gonna listen to you. If you have any pain or anything, I'm gonna listen and then feel. You just let me know, okay?
Okay.
Gonna start in the right lower, then I'm gonna go to the right upper, then the left upper, and the left lower. And the patient is normoactive times 4 quadrant. And if I heard no bowel sounds, I would listen to 5 minutes in each. Any problems with that? I'm just gonna feel. Any pain or tenderness noted? All right. And since we already have you laying, can you rotate or move your ankles? Active range of motion in the ankles is noted. Can you bring your knee up? Any pain or anything with that? What about abduct your hips? So the patient has active range of motion in the ankles, the knee, and the hip. You can go ahead and sit on up for me. Can you bring out your legs? The legs are symmetrical, no problems there. I'm gonna come down and look. The hair is distributed equally. The color is appropriate to ethnicity, no bumps, lesions, or anything noted. I'm gonna have you take off your sock. No edema noted. Gonna assess the foot. The toenails, I can't do tap refill since there's toenail polish. But the toenails are nice and rounded, no ingrown toenails noted. The bottom, there's no lesions, torn, anything noted like that. Everything looks good. I'm gonna assess your popliteal pulse. And that one's non-palpable, so I'm gonna go down and assess your other ones. I'm going to do the dorsalis pedis, and that's a strong 2+. Now I'm going to do the posterior tibial, and that's a strong 2+ as well. Now I'm going to do your quadricep reflex. You can just stay like you are, and that's intact. And then I'm gonna have you touch each finger to your finger, or touch each finger to your thumb, I'm sorry, and that's saying you have fine motor control. And then I'm gonna have you pull against, push it against, push, pull. The patient has a muscle strength grade 5 in the leg. And then I'm gonna have you do the same up here. Can you grip my fingers? And then you're gonna push and pull, and the patient has a grade 5 in muscle strength in the arms and the wrist. And I think that's it. Do you have any questions?